To begin, Rocio is an environmental health specialist, plan reviewer, and registered sanitarian for Pima County Health Department at Consumer Health and Food Safety Division. Rocio earned a Bachelor of Science in Dietetics and a minor in Biochemistry from the University of Arizona. She is a part of the Foodborne Illness team, and she is passionate about food safety, education, and compliance to prevent foodborne illness outbreaks. Next will be Lauren Dinauer. Lauren is an environmental health specialist, registered sanitarian with the Pima County Health Department, doing food safety inspections as well as environmental assessments with the Foodborne Illness Response Team. She writes educational newsletter articles for operators and staff of permitted Pima County facilities and teaches a food safety class for Pima County facility operators and food handlers. She has written procedures to assist with obtaining conformance with the FDA Standard 5 Foodborne Illness and Food Defense Preparedness and Response in the Consumer Health and Food Safety Division at Pima County Health Department. She has a Bachelor's of Science in Biology and a Bachelor's of Art in English from the University of Arizona.
Good afternoon, everyone. My name is Lauren Dinauer, and I'm an environmental health specialist with the Consumer Health and Food Safety Division of the Pima County Health Department. I will be presenting on the first portion of the Salmonella Braenderup investigation, including aspects of the routine inspection. Rocio Alvarez, the lead inspector of the investigation, will be presenting on the environmental assessment, sampling processes, and outbreak resolution procedures. So the Consumer Health and Food Safety team, as well as our epidemiology team, have an already established framework for fielding foodborne illness events. Illnesses related to this specific outbreak span a lengthy time frame, nearly 1 year. We conducted environmental assessments as well as routine food safety inspections at 2 suspect locations when the epidemiology team requested. Throughout the investigation process, it was important to communicate to the operators the general reasons that 2 inspectors were present, myself to conduct the routine inspection and Rocio to conduct the environmental assessment in order to resolve what we referred to as a cluster of Salmonella cases. We believe that framing our initial site visits in this general manner would help get the operators on board with the investigation, including why additional site visits may be necessary. Keeping in mind that the operators and inspectors have a shared primary goal to keep their customers safe, helps keep the operator on board and better implement safer culinary practices. We reviewed all available illness information and identified key areas of the cook line to observe food handling. The fact that eggs were consumed by the majority of those who became ill and were diagnosed was helpful information for determining workstation areas of interest. We did verify that egg products were safe once we were on site, as far as not being part of any recall or anything like that. A thorough review of the facility, previous inspection history indicated that proper cooling methods and a thermometer present or not being present were observed out of compliance in the recent past. Observed out of compliance items during the routine food safety inspection I conducted also included improper cooling methods and thermometers not being accessible. Employee food handling at the egg station persisted as an area of interest even after the initial site visit. And this photo on the right is just a photo of what the egg station looks like most often. The line list information provided prior to the routine inspection identified areas of interest involving employee egg handling in relation to employee hygiene and contamination of food as well as food equipment. The egg station was the most consistently busy station on the cook line and had the highest dynamic risk due to the employees switching between handling raw and ready-to-eat foods, sometimes multiple times in order. That was what was observed during the routine inspection, and they have since modified their procedures. The foodborne illness risk factor violations observed out of compliance at the routine inspection included hand washing regarding when to wash hands, how to wash, and bare hand contact with ready-to-eat foods, cross-contamination involving raw animal products being stored above exposed ready-to-eat foods and cleaning equipment, insufficient cleaning and sanitizing processes and procedures resulting in surfaces not being cleaned to sight and touch, especially in hard-to-reach areas of multi-use food contact equipment. The facility also had issues with cleaning frequency for temperature controlled for safety food contact equipment surfaces that are stored at ambient or room temperature used on the cook line. Those require a 4-hour cleaning frequency. Warewashing procedures involved inadequate sanitizer concentration and employee knowledge, lack of employee knowledge for proper manual warewashing. Both of the make tops on the cook line were cold holding temperature controlled for safety foods at temperatures above 41, and facility was using those equipments not designed for cooling to cool a lot of the foods that were stored there. Cold holding equipment not working properly and thermometers stored at back area of kitchen not accessible nor regularly used by employees on the main cook line were contributing factors in a significant reduction of overall cold holding capacity issues. During the routine inspection, we observed employees on the cook line, including the egg station employee, improperly clean hands. Hand washing was abbreviated to approximately 5 seconds, and no soap lather was created to effectively remove food debris from hands prior to rinsing and drying. Hand washing did not occur when required. We observed the egg station employee cracking shelled eggs, then handling ready-to-eat foods at the make top shared by the sandwich station employee, which required immediate corrective action. In addition to improper hand washing, another employee primarily tasked with removing soiled plates and utensils from customer tables re-entered the kitchen and plated a slice of pie with their bare hands. Hand washing prior to plating the pie did not occur, and the employee was educated on bare hand contact with food not being safe, and that in addition to using utensils and or gloves to serve the pie, the employee would also need to clean their hands when they switch from clearing tables with soiled food equipment to preparing food in order to prevent contamination when switching tasks. Make unit 2 on the cook line, we had raw animal foods, the chorizo shown here, stored above open and exposed, ready to eat foods. A lot of the food containers that they had were in a state of disrepair, so they had some cracks and things. The equipment did not have any separation or partition below the raw chorizo and above what was clean plates that were stored below that, as well as ready to eat foods. Improper storage of raw animal products also occurred in the walk-in refrigerator where raw chorizo was observed above open and exposed lettuce. When asked about the frequency of cleaning food preparation equipment held on the cook line at room temperature, used to prepare temperature controlled for safety foods throughout the shift, the person in charge stated that the equipment, including cutting boards on the cook line, spatulas and utensils held at room temperature, person in charge stated that those were cleaned daily. The warewashing area also had cleaning and sanitizing issues. The equipment was not dispensing adequate sanitizer concentration, about 10 parts per million, and employees did not know how to test the equipment. The facility was actively cleaning and sanitizing food equipment during this process, and equipment needed to be re-washed, rinsed, and sanitized at the 3-compartment sink. Even after informing employees about the warewashing equipment not working, and that the staff would have to shift to using the 3-compartment sink, the facility attempted to put away dishes that had been cleaned by the warewashing equipment that was not properly sanitizing food equipment. So this is just a a photo at different series of photos from different site visits of the deli slicer. The facility struggled at multiple site visits to properly clean the deli slicer. The person in charge was provided an electronic version of the operation manual for the slicer when the owner of the facility stated that the slicer was impossible to clean. The slicer required additional cleaning after being stored as clean at both the routine and routine follow-up inspections, as well as at other site visits. Raw shelled egg pallets that were stored at ambient were reduced, and facility repaired the cold holding equipment at the cook line so that cold holding and capacity issues could be corrected from the routine inspection. At additional site visits, however, egg pallets stored at ambient numbered between 3 to 5 pallets. That totals like 72 eggs undergoing consistent temperature abuse. During the routine follow-up, myself and another environmental health specialist, Ana Lopez Francisco, provided educational materials, observed the implementation of the required corrective actions, and communicated general areas of concern based on initial sampling results. After informing the person in charge about sampling information regarding affected surfaces, we provided copies of photos where samples were taken from and a list of affected areas at the routine follow-up. We reviewed clean in place, cleaning and sanitizing procedures, and informed the person in charge that the entire facility should be deeply cleaned just based on the number of positive swabs that we got back. They, in addition to deeply cleaning their facility, also needed to properly demonstrate cleaning procedures while we were on site. The person in charge implemented the following steps for the affected surfaces after erroneously stating that bleach cleans everything. Step 1, wash with soap and hot water of at least 110 or whatever the detergent manufacturer label states. You want to generate a really strong lather and then rinse. For the second step, step 3, disinfect the surfaces by using 1/3 cup of bleach per 1 gallon of water, which yields a concentration greater than or equal to 1,000 parts per million. The person in charge was educated on the fact that the solution remaining on the surface for 10 minutes in order to ensure efficacy is a requirement. The solution preparation method was based on the label information of the bleach bottle on hand at the facility for Salmonella disinfection specifically. We recommended that the facility do an initial first application of the disinfection solution, and then after 5 minutes, do a second application to ensure that the surface remains in contact with the solution for the full 10 minutes. After the disinfection, the facility did a sanitizer post rinse for food contact surfaces at a food safe concentration of bleach, which is about 50 to 100 parts per million. And that was applied on surfaces and allowed to air dry. We reviewed the cleaning procedures with food employees, and employees began cleaning the affected surfaces, such as the deli slicer and prep table. They were right in the middle of their lunch rush, so just demonstrating that they were able to start on the deli slicer and prep table properly was a good start. The person in charge stated that they would ensure all other affected surfaces and areas also receive the same cleaning procedures that we demonstrated for staff. The facility was educated on enforcement actions for repeat foodborne illness risk factor violations, and inspectors strongly recommended that the facility obtain a small brush to use for cleaning hard to reach surfaces of the deli slicer. Well, we did not directly disclose to the facility that additional site visits and additional sampling may occur. We discussed with the person in charge the importance of ensuring that the facility is cleaned properly. The person in charge was instructed to remove or pull out items during this cleaning process to the furthest extent possible to ensure that affected surfaces are thoroughly cleaned and disinfected. The facility, in addition to doing that cleaning and disinfection procedure, also implemented corrective actions that included food preparation table that is located near the walk-in refrigerator, designated as a table for cutting and preparing raw animal foods. They also had to move some stuff around to prevent raw animal foods prepped on the table from contaminating items stored below, such as the flour and sugar bins. And then the person in charge reviewed and provided copies of handouts that they were given at the routine inspection, including when to wash your hands, how to wash your hands, no bare hand contact with ready-to-eat foods, and as well as the employee reporting agreement form 1B to ensure that employees knew those foodborne illness symptoms, that they are not permitted to work in a food establishment while they have those symptoms. We continue to remind the operator that we have a shared primary goal to keep their customers safe, and we believe that helped keep the operator on board, especially due to the fact that the facility site visits, it involved 5 site visits in a time frame of just over 4 weeks. So they saw us quite a bit. And for this segment, Rocio is going to be taking over.
Thank you, Lauren. This is Rocio Alvarez, and I will be explaining the environmental assessment. During the initial food safety routine inspection, the environmental assessment was conducted. We focus on the most common risk factors that could have led to the Salmonella Braenderup outbreak. Those risk factors consisted of inadequate cooking temperatures, poor employee hygiene, bare hand contact with ready-to-eat foods, contaminated food, exposure to infected animals, and cross-contamination. In addition, the line list provided by the epidemiology team was analyzed, and we found that the eggs and the toast were the 2 most common food items consumed among the individuals that were diagnosed with Salmonella. Therefore, we spent quite some time observing the food flow and the food handling practices near the egg station. A very important aspect during the environmental assessment was to analyze the food flow and the layout of the restaurant. Determining the flow starting at the receiving door through storage, preparation, cooking, assembly, hot holding, and ending with the customer is critical, as contamination of ready-to-eat foods can occur with poor food flow. The work table shown on this picture shows a mounted deli slicer, a stand mixer, and a variety of dry food products above and below the table, clearly showing that multiple food processes take place on this specific table. After asking a few questions to the owner up at the work table, we found that this was the main work table used to prep raw poultry and pies using unpasteurized shelled eggs. However, raw animal protein foods were prepped at any of their 3 work tables. The restaurant did not have a specific work table assigned for prepping raw animal products. It was reported by the owner that raw poultry was only prepped after closing hours by management only. Nevertheless, the possibility of cross-contamination between raw animal protein residue with ready-to-eat food or with equipment stored as clean was substantially high due to the poor layout, which entails having mounted food equipment on prepping tables where employees work with raw animal products, and the lack of proper cleaning and sanitation procedures. Their cleaning and sanitation procedures for the work tables, cutting boards, deli slicer, and other equipment skip the cleaning step using detergent. Furthermore, the contact time specified by the sanitizer's manufacturer label was not followed. Some of the questions asked to the owner during the environmental assessment were the following. From where or what company do you get eggs from? Does anybody bring eggs from their house or farm? Where are the eggs stored and to what temperatures are they received? Where do you purchase produce? Has the facility experienced a water outage? Do any of the employees work at different restaurants or grocery stores? Do employees use thermometers to check food temperatures? Do you make peanut butter? Are employees allowed to bring their pets in the facility? Do you know if any employees have turtles or reptiles at home? After the interview, the area of concern was the lack of using thermometers to check food temperatures. Based on the findings from the routine food safety inspection, the environmental assessment, and the highest risk areas where Salmonella may thrive, the FBI team, in conjunction with Connor Fitzgerald, a foodborne disease epidemiologist, we selected the following zones for sampling. The zoning concept was utilized as it provides valuable data on the source and concentration on specific organisms. We sample zone 1 and zone 2. Zone 1 refers to all direct food contact surfaces, such as deli slicers, cutting boards, racks, work tables, etc. Zone 2 includes all non-food contact surfaces, such as the exterior of equipment, specifically areas that are difficult to reach and clean, including cracks and crevices where product residue accumulates. On May 24th, a total of 26 areas were sampled. To sample the areas, we used a quick release handle, a sterile sampling sponge by Solar Biologicals. The size of the area sample was about 12 inches high by 12 inches wide, and both sides of the sponge was used. During the environmental sampling, I was in charge of swabbing the areas. Lauren was in charge of labeling each individual bag for each sponge, and also filling out the microbiology analysis form, one form per sponge. And Connor was in charge of taking pictures of all the areas that we sampled. After sampling was accomplished, we completed the microbiology food analysis. This document is extremely important for establishing that sample integrity was maintained from the time of collection through the time of analysis. The bottom portion of this form is called the chain of custody, which is the process by which authorized custody of a sample is successfully transferred from one person to another by the use of approved procedures and documents. This form includes a description of the area sampled, reason for sampling, collection date, and signatures of the environmental health specialist collecting the samples. Also the person in charge of the restaurant and the person shipping samples to the state lab. All the samples collected along with the microbiology food analysis form were shipped to the state lab on May 25th, a day after the samples were collected. On May 27th, we received preliminary results that indicated the presence of Salmonella DNA without the serotype. 8 out of 26 swabs came back positive, and they are the following. The prep table where the deli slicer was mounted. The egg prepping table. Cutting board at the egg prepping table. The egg make-up handle. The exterior of the microwave. The walk-in handle. The bottom egg of the prepping table. Now, on June 9th, we were informed that Arizona State Health Laboratory had confirmed that the environmental samples collected from May 24th match the clinical samples taken from patients diagnosed with Salmonella Braenderup. Immediately, the lab overnighted 15 additional sponges to collect more samples. On June 10th, we returned back to the restaurant and collected samples from the areas that previously tested positive, in addition to other areas as well. On June 22nd, we received confirmation that 7 out of 15 sponges came back positive for Salmonella, including the areas that employees had already cleaned and sanitized to destroy Salmonella, and they are the following. The exterior of the microwave, the walk-in handle, the bottom of egg prepping table, deli slicer, expo table, toasters. On June 23rd, Pima County Health Department issued an imminent health hazard with a temporary closure, prior allowing the restaurant to reopen for business purposes. The immediate corrective actions consisted of properly and effectively cleaning and sanitizing all food and non-food contact surfaces. In addition, the owner was asked to hire a professional cleaning company, subsequently to hire a pathogen environmental testing company whom will be responsible for sampling or swabbing all of the areas that tested positive for Salmonella, in addition to other areas of the restaurant. After employees finished with all of the on-site customers, we physically demonstrated how to properly clean and sanitize food and non-food contact surfaces for employees. Non-fixed equipment was moved to properly clean areas that are usually difficult to reach. Walls were scrubbed and everyone was cooperating. Fortunately, the remediation company was able to provide their professional cleaning services the same day of closure. As a result, the restaurant was able to reopen for business purposes the following day. And Lauren will explain a little bit of the remediation.
The chemical blend that was used for the professional remediation service is a proprietary disinfection solution specific to the targeted contaminant and is applied to the affected areas. Surfaces are also wiped down by the professional remediation company after the chemical application procedure. The facility left exposed food contact equipment surfaces, cutting boards, deli slicer, microwave, and other food preparation equipment to remain in place for treatment by the remediation company. The person in charge stated they would ensure all treated surfaces were cleaned after the treatment using a wash, rinse, and sanitize procedure. Not a lot of information was known about what was in the solution, but having the person in charge say that they were gonna rewash, rinse, and sanitize those food contact surfaces was a precaution. And they had to vacate the premises for 2 to 3 hours. They don't really know what areas the company sprayed. And they used an electrostatic sprayer. The staff was from the professional cleaning company was pretty confident that the solution, because it was charged, would provide entire surface coverage for total disinfection of all designated affected areas. And this is some preliminary research that the EPA did during the COVID response that we got. And they kind of went over just real briefly some of the results from their studies, or at least their preliminary results. So let's see.
On the left side are the positive controls that.
So they're explaining the wraparound effect of these charged particles. The F is for front, the right, or the R is for rear. Right and left. So obviously the front one had a lot of surface coverage, but you can see that we didn't really have a wraparound effect on the back area. The only reason I'm going over this is because we've had some recent developments after the remediation service occurred. And so just in the interest of knowing a little bit more about those services that they provided, you can see that there was a lot of the solution that was deposited onto the sides of this surface, but we really don't have any coverage on the back. So if the technicians applying this solution are believing that it's going to evenly cover all areas of the affected surfaces, it's maybe not necessarily the most accurate. Here we have a timeline starting from the food safety inspection and environmental assessment that was conducted on May 18th and finishing when the restaurant was issued an imminent health hazard and closure, when the remediation started on June 23rd. Post-remediation processes involved increasing the inspection frequency for the facility known as a full service risk-free restaurant. The frequency of routine food safety inspections increased from 3 to 4 just for this year. Foodborne illness risk factors to be controlled and prevented through active managerial control were poor employee hygiene and contaminated equipment. And we wanted to, the hazard was identified as Salmonella Braenderup. As far as what must be achieved to gain compliance in the future, so we don't have issues like what we were seeing at the routine inspection, and so we don't have a foodborne illness outbreak, would be the development and implementation of standard operating procedures to ensure that all ready-to-eat foods are safe from cross-contamination. We would want active managerial control, reinforcing effective employee hygiene practices, dishwasher sanitizer concentration logs, deep cleaning, and frequency of cleaning logs, as well as testing. After approximately 1 month after the risk control plan meeting, the facility had a risk control plan site visit, and I did observe that the slicer was stored as clean, but not clean to sight and touch. In areas in the very center of the equipment that had previously tested positive, we had some quite a bit of food debris. And then in the portion along the blade on the backside that a lot of people miss when they're cleaning, I assessed whether or not the person in charge was present, employee health and hygiene knowledge, hand washing, food equipment surfaces being cleaned to sight and touch, and then food being protected from cross-contamination as part of the risk control plan. Let's see. So 3 persons were identified as people in charge that were tasked with the responsibility of achieving active managerial control. Employee verification records and cleaning logs included a hand washing log, a dishwasher log, a routine cleaning schedule for the egg station surfaces, the slicers, and other identified surfaces that require a 4-hour frequency of cleaning. The owners agreed to monitor employees throughout the day and ensure that employees take corrective actions when required. One example being observing employees hand washing for specific timeframes throughout the day, at least 3 times a day, every day, and logging that. Risk control plan results based on the 2 that have been conducted thus far resulted in me observing that we did have that food equipment stored as clean, that was not clean to sight and touch. And I did observe that employees had modified their hand washing procedures and recognized when to wash, and all were demonstrating proper hand washing when I was there. This is the summary of our positive surfaces that tested positive for Salmonella. In the first column, we were able to do a serotype. So those matched the serotype that made those individuals ill. And then the stuff that's in red, those are repeat positive surfaces. So surfaces that the facility just struggled consistently to properly clean. And in the third column here, the facility did their own testing of these surfaces that was required for their risk control plan. So they tested 10 surfaces. And this column here, we have some pending results. So this is a summary of our percent positives. We only had 26 swabs the first time, and 8 of those 26, so about 31% of the surfaces that were sampled had matched the serotype. The little asterisk here is because we only had a partial sequence, but the lab believed that it was highly related to Salmonella Braenderup, but it was only a partial DNA sequence that they were able to get on that one. And then the surfaces that were positive are listed here. The second time we went, we had less swabs, but we got 47% of the surfaces tested positive for Salmonella, but we did not do serotyping for that. And in the third column, when the facility did their own testing, and they did show us their results, so we were able to verify that the results were saying negative. We just were not present when they did their own retesting. So they got 0% of their surfaces sampled. So we did have some new cases after the June 23rd professional remediation. The areas that tested positive for Salmonella at either the initial or second collection dates were resampled yesterday. So the focus for yesterday's sampling, and we had 50 swabs for those that we used in various areas, including the cook line, the back prep area, the walk-in refrigerator, warewashing areas, baking shelves, multi-use food equipment that was too large to fit in the 3-compartment sink. We increased the amount of zones that we sampled because we were looking for something that was more of like a reservoir. So in zone 1, we had like those slicers and vegetable peelers, cutting boards, and then zone 2, the shelving, storing equipment in the back prep areas, on the cook line, stuff that's not direct food contact surfaces, but right next to it. Zone 3, we did floors, walls, and ceilings, ventilation systems, hinges, and gaskets of equipment. And we even expanded to zone 4, the linen closet, because during a recent site visit, they had used linens in direct contact with food. Linens that are cleaned by a professional cleaning company, but used for wiping surfaces, not for food preparation. We also did the personal belonging storage areas, chemical storage areas, and dry storage.
Here is a picture of the FBI team involved in the process. The gentleman holding the ice chest for samples is our program manager and FBI director, Gary Frucci. He's responsible for coordinating efforts between the Pima County Epidemiology and Consumer Health and Food Safety teams. To the right, we have Gretchen. She's a communicable disease investigator for the Pima County Health Department. Next to Gretchen, we have Lauren, and then it's myself. We do want to thank to all of the people involved in helping us with this ongoing investigation. And thank you for the participation of Vanessa Taylor from the EPI team that participated in this investigation yesterday when we went to obtain more swabbing samples. Thank you so much, everyone, for listening to our investigation.